Hello, my name is Dr. Jose Luis Ruiz, and I'm the director of the Los Angeles Institute of Clinical Dentistry. And it is really a pleasure to share with you this technique called enamel margin preservation. This technique is an integral part of the supragingival dentistry protocol. Why supragingival dentistry? Because traditional restorative dentistry to date has been usually leading us to have subgingival margins. And this is the case for the past 100 years. And the reason is because with traditional approach, using traditional boxes, dropping the margin to achieve proximal clearance, the need for axial retention, axial walls, even sometimes for aesthetic reasons, we end up placing margins below the gums, and that leads to lots of complications. I would like to share with you a technique that will minimize the chances of ending up with subgingival margins even when the caries appears to be subgingival. Let me show you how. Research is very clear. When we leave margins that are imperfect below the gums, the consequences really is just like leaving permanent tartar. Bacteria will colonize those imperfections, and the gingiva will be unhealthy. The literature shows this. Additionally, we all know that the gingival margins are complicated. Double core technique, bleeding during cementation, complications that we don't need. We have lots of new materials today, but sadly, often we prep with traditional GB black preparations. Too much tooth is removed, subgingival margins are placed, and the results don't really benefit a lot of our patients, and they don't benefit us because they tend to be difficult to do. On the other hand, when we use supragingival minimally invasive techniques, it is truly a paradigm shift. When we trust in adhesion, we don't need axial reduction, we don't need boxes. We know that the adhesion will retain our restoration, so we can stay above the gums, and that really makes our patients' periodontal health better. It makes restorative dentistry more predictable when we learn how to utilize supragingival dentistry. I have been an advocate of supragingival dentistry for many, many years. I've written many articles, as some of you may be aware. And I tell you why. Because adhesive dentistry does not mix with subgingival margins. This picture right here tells you the whole story. This is a dentist on the left. She had an onlay placed by a colleague which failed multiple times. She was very frustrated. And you can see why. You know, the margins are subgingival. Every time there was an attempt to cement that onlay, there was leakage for sure, and it just never bonded correctly. The picture on the right tells you the consequences. There is contamination during cementation. There's leakage from day one, and the consequences are very undesirable. So as a practicing clinician who's performed many, many thousands of these restorations, I feel that keeping the margin supragingival is paramount to success, and using the 5 rules of supragingival dentistry makes that possible, even in cases where it seems almost impossible. So we're going to talk about the rule number 3, enamel margin preservation. And right here on the x-ray to the right, you can see a case that traditionally we would imagine it would be way subgingival. The caries on the dentin is very deep, but the enamel is healthy. The enamel, which is still supragingival, is healthy. So understanding the research shows that when we reinforce weakened enamel with bonded composite, that enamel will regain close to its original strength. Then we will preserve the enamel, restore it with composite, properly bonded composite. And from there, we take our impression, we put our final restoration on top of that. As you see on picture number 2, the day of the cementation is very simple and predictable because we have supragingival margins, and the patient will benefit greatly by this type of procedure. On the video that you see now, we're doing it on a typodont. You can see a very, exaggeratedly K tooth. This is one of the teeth that we use on our workshops at the LA Institute. And after occlusal reduction, because we already know we're going to do an onlay on this case, you can see how much caries. We continue to remove the caries. We leave the enamel that is healthy. We remove the caries on the dentin, preserving the enamel. And as you can see, the caries on the dentin continues to go quite deep. once we remove the caries on the dent, and we can repair the enamel with bonded composite, as you see right here, a matrix band. And after repairing that enamel, then our margins will be supragingival and the cementation will be very, very simple. This is a clinical case very similar to what we just did. You can see extremely decayed tooth. After the removal of caries, we still have a sliver of enamel that is above the gum. Then we go back, repair that enamel using that enamel preservation technique. This slide shows you the day of the cementation, the healthy gum. It shows you how easy it's going to be for us to bond predictably that onlay, how much tooth we preserved. And this is really technique that makes life a lot simpler. Of course, using good adhesives. This is Clearfield C Protect, and using proper techniques is paramount to success. If you're interested in learning how to do and perform more of this supragingival minimally invasive dentistry, I invite you to visit my website, where we have many courses where we're very, very detailed in how to be successful with the techniques. If you have any questions, this is my email, my website. It has really been a pleasure to share this information with you, and have a great day.